And nearly 63% of people who end up in the hospital because of COVID-19 also end up with injury to their heart. Now, a new study backs that up. So why does it happen? We're talking it over with Dr. Eli Azraq, who is a cardiologist with SSM Health DePaul. Good morning to you, doctor.
Good morning. Thank you for having me.
You're most welcome. Well, is this happening to people who didn't have heart issues or those with perhaps pre-existing heart issues?
So far what we know is the virus can affect anyone, frankly, and the majority of individuals who have the virus can have injury to their heart. So we see that a lot. The more pre-existing conditions you have, the more likely to get sicker when you get the virus, but it affects anyone.
So what exactly is the damage to the heart? Are you seeing different kinds of ailments?
So when we see injury to the heart, we see it through blood work or through symptoms of congestive heart failure or chest pains or palpitations and so on. What we know so far is the virus can directly affect the heart by entering into the heart muscle and directly infecting the heart muscle. But also the heart can react to a general inflammatory condition within the body, and this can cause stress on the heart as well.
Doctor, can this be long-term damage?
So we've been dealing with this pandemic for about 10 months now. What we know is permanent damage can happen in the form of congestive heart failure or rhythm problems or the consequences of having heart attacks. But we also know that a lot of individuals are having cardiac symptoms and don't necessarily have permanent damage to the heart. Nonetheless, they still need to be checked and make sure that their heart is okay.
And as far as prevention goes, I'm guessing it's your basic measures to prevent COVID as well as living a healthy life to prevent heart disease.
Yes, because we know that individuals with high blood pressure, diabetes, obesity, and so on are predisposed to a worse infection and can get sicker when they get the virus. Basic prevention is critical at this juncture. So not only wash your hands, wear a mask, stay socially distanced, but also try and live a healthier lifestyle. Definitely, it's important.
Very good. Doctor, thank you so much for sharing that important information with us. We appreciate it. And for our viewers who would like more information about the connection between COVID and heart injury, we will provide links to those studies on our website as well as on our Fox 2 mobile app.